In this video, we are going to talk about post-COVID-19 syndrome and vestibular rehab intervention. Most people who have COVID-19 recover completely within a few weeks. But some people, even those who had mild versions of the disease, continue to experience symptoms after their initial recovery. These people sometimes describe themselves as long haulers, and the conditions have been called post-COVID-19 syndrome or long COVID-19. These health issues also are sometimes called post-COVID-19 conditions. These health issues are generally considered to be effects of COVID-19 that persist for more than 4 weeks after people have been diagnosed with COVID-19. The World Health Organization has developed a working clinical case definition of post-COVID conditions. Post-COVID-19 condition occurs in individuals with a history of probable or confirmed SARS-CoV-2 infection, usually 3 months from the onset of COVID-19, with symptoms that last for at least 2 months and cannot be explained by an alternative diagnosis. What are the symptoms of post-COVID syndrome? Just as COVID-19 itself can come with a range of symptoms, so, too, can post-COVID syndrome. The most common symptoms that can linger include fatigue, difficulty breathing, joint pain, chest pain, brain fog, including an inability to concentrate and impaired memory, loss of taste and/or smell, sleep issues. We're not sure exactly how long these symptoms can persist, but we know that they can last at least 6 months or longer in some people, according to experts. The manifestations of these symptoms are interesting and somewhat unique. For instance, MRI scans show myocarditis in some of these people, indicating that the heart muscle can remain inflamed several months out even if heart-related symptoms weren't prevalent during their illness. Studies showed that 63.2% in 30 days, 71.9% in 60 days, and 45.9% in more than 90 days of the sample exhibited more than one post-COVID symptoms after onset or hospitalization. Fatigue and dyspnea were the most prevalent symptoms, from 35% to 60% depending on the follow-up period. Post-COVID-19 syndrome in pregnant women. Symptoms may include a sudden onset of vertigo, nausea, vomiting 1 day before admission complicated by left-sided facial weakness and fullness of the right ear with tinnitus. Expression of symptoms may be without a previous history of vertigo, head trauma, otitis, or tick bite. Post-COVID conditions in children. Post-COVID conditions were first described in adults. But several studies now report a similar phenomenon in children, with persistent symptoms after acute COVID infection such as headache, fatigue, and heart palpitations. Even children with an asymptomatic or mildly symptomatic COVID-19 infection can develop chronic, persisting symptoms. Almost 10% of children aged 2 to 11 years and 13% aged 12 to 16 years reported 1 or more lingering symptoms 5 weeks after COVID-19 infection. Vertigo after COVID-19 infection. Vertigo is a type of dizziness, defined as a false impression of movement brought about by lesions in the central or peripheral vestibular system. The association between SARS-CoV-2 and ear disorders has not been confirmed yet. However, some studies reported an association between SARS-CoV-2 infection and newly diagnosed vestibular neuritis. Patients developed acute vertigo attacks after the infection that lasted for variable periods after recovery from COVID-19. Benign paroxysmal positional vertigo, BPPV, in COVID-19. In a particular study performed at the height of the COVID-19 pandemic, 8 patients affected by COVID infection and vertigo. The vestibular findings were indicative of benign paroxysmal positional vertigo, BPPV, in all the patients. 3 patients had a mild phenotype of COVID infection, whereas 5 subjects were hospitalized for the COVID infection, and in 3 cases intensive care was required. No patients were referred for a previous history of vertigo or deafness. All patients experienced rotatory vertigo any time they tilted or changed the position of the head, associated with nausea, vomiting, and unsteadiness. How can a physical therapist help? Physical therapists can help COVID-19 long haulers by treating the effects of PASC. They may recommend activities that people with long COVID can do at home, including low-intensity stretches to improve range of motion, and strength and balance training. Movement is essential to your recovery. The goal of physical therapy is to improve your strength, stamina, and quality of life through prescribed movement. Others with vestibular disorders will benefit from skilled vestibular rehabilitation depending on complete evaluation of their symptoms. At Therapy Consultants, the expertise and the technology allow us to carry out comprehensive assessment on everyone. The unique setup allows multidimensional approach to this multi-organ involvement as in many cases of COVID-19. Feel free to contact us today for your vestibular consultation. You don't have to live with it. If you like this video, please don't forget to like and subscribe.